All right. To start off, a quick overview of depressive disorders. The prevalence. I mentioned this before. Major depressive disorder is actually the most common mental disorder that there is in DSM-5, at least within the United States. The lifetime prevalence is nearly 17%. So that means that at some point in a given person's life, there's a 17% likelihood that they will be diagnosed with major depressive disorder. The 12-month prevalence rate is actually nearly 7%. So that means in any given year, 7% of the population is likely to have major depressive disorder. And of course, you can probably guess uh, with that prevalence rate, that means that many people have recurring major depressive disorder at various points in their life. And we know that for for each of the depressive disorders, they are about twice as common in women than in men. So it is much more prevalent among women than men. The second mental disorder, depressive disorder, we'll talk about is less well known. It's called persistent depressive disorder. The lifetime prevalence is somewhere between 2.5 to 6% for, again, Americans. The persistent depressive disorder was previously called dysthymic disorder, and I think they just felt that was too old-timey of a word, and so they updated the language, but basically made very little changes in terms of the how to diagnose it. By definition, it is a period of mild to moderate symptoms of depression lasting over 2 years. And intermittent normal moods can occur briefly, but overall, their mood is characterized by depression. And um, the second one is called major depressive disorder. It involves at least 5 symptoms of depression for at least 2 weeks. So the minimum length of time for the persistent depressive disorder is at least 2 years. Major depressive disorder, because it's major, it is only needs to be present for 2 weeks, and the mood disturbance cannot be interwoven with normal mood. So the person cannot, during those 2 weeks, feel normal some of the time, uh, other than just for a few moments or maybe an hour or two. They need to feel this way pretty much predominantly the whole day. Now, it is possible, and it's called double depression. It is possible to have both persistent depressive disorder and major depressive disorder. And that's a case where a person that has persistent depressive disorder can develop major depressive disorder, and their symptoms sort of exacerbate. And so that is a possibility, but again, these are considered separate disorders.